Hey, we've got another conversation with Dr. Klein, and oh, these things are interesting. So, what we want to talk about today, if you can imagine, is relative causality. What do we mean by that?
Okay, well, it works a little something like this. Okay, just because A might be true doesn't mean that B follows. Okay, and this is an important concept. And it sounds like, well, I'm going to be rambling again. And in fact, I will be rambling again, but this is going to be very meaningful to you. In medicine, okay, we have all manners of blood studies, blood tests here, we have x-rays there, we have MRIs, we have all kinds of scanned studies, many of which we do right there at Stages of Life, by the way. But it doesn't necessarily mean that what you find caused what you're complaining of, okay? And this is key, okay? Just because you have an MRI finding, just because you have a bulging disc, it doesn't mean anything. It doesn't mean that you have any pain. It doesn't mean you have any numbness. It doesn't mean that you have any weakness. Most people with these radiological issues don't have any symptoms at all. To wit, okay, if you went to the mall, just pick a mall. I'll pick on Millennium Mall because you can't park there, okay? And you do an MRI of 100 people that are totally asymptomatic. These are people walking the mall, spending money on things they don't need, probably never going to use, okay? And you do these MRIs. 1/3 of them are going to have a bulging or herniated disc on their MRI. Now, they're not hurting. Remember that. Now they go out into their garden and they go about their business, or they're walking down the street and they slip and fall, or they lift something funny and they pull a muscle. Okay, and this is a problem because muscle pulls hurt. When you jam a joint, SI joint, it hurts. When you tear a ligament, believe me, it feels bad, and it can hurt for months at a clip. That's just the way these things go. So the well-meaning doctor, instead of doing a physical exam to figure out where the problem actually is and what caused it, or even do a decent history to work their way through it, they're going to get the knee-jerk MRI. We used to call it the Keflex reflex. Somebody comes in with an infection, you gave them a prescription for Keflex. Might explain why we have so much MRSA these days, because we weren't any smarter then than we are now. So we do an MRI. You have bulging discs. Let's do physical therapy 3 times a week for the next 6 to 12 weeks, and after that we'll do 3 epidurals, and then we'll do surgery, because, by the way, none of the above is going to work if time doesn't on itself. Okay, but the fact is that the bulging disc has nothing to do with your muscle pull. And this explains in very easy terms why it is that 2/3 of people that have spinal surgery either stay the same or get worse. Okay, it's because there was no demonstration of causality. You have to know that the physical finding, the radiological finding, the chemical finding actually is causing your disease state. And we do this all the time. Well, you have fibromyalgia, so we're going to do an EBV, Epstein-Barr virus titer on you. Okay, well, by the way, everybody has a positive EBV. Okay, if you don't, I worry about your immune system being inadequate. So everybody has a positive EBV. Everybody has a mumps. Everybody has a positive monotiter. Okay, that did not cause your fibromyalgia. It did not cause your chronic fatigue syndrome. You have to look for the right thing in order to find the right problem, okay? And when you find something wrong, it doesn't imply causality. Now, when you're doing blood work, okay, and I guess the government, the CLIA is what they call the organization, has deigned me. They dignified me with a title, of highly complex laboratory director. Why? I don't know. It's kind of like I just wanted one more piece of paper on the wall. Who knows? Okay, but I'm one of those guys that gets to decide what the normal ranges are. Okay, so when you look at those things and you think you're interpreting these lab studies, it's within range, I must be okay. I'm as smart as the doc. Actually, you might be, but it has nothing to do with reality, okay? Because that range simply tells you what 95% of the population is doing at any one time. Therefore, 2.5% on the north, 2.5% on the south, they must be abnormal, when in fact, it may be 1/3 of the people in there, or none of them are sick at all. What's a normal lithium level? I love asking doctors that question because they give me a blank stare. Well, there shouldn't be any lithium in your blood at all. And I'll correct them. Lithium is the 3rd most prevalent element in the universe. You don't think you have some in your blood? Okay, so you only checked it when you're looking for lithium toxicity. But you have to have enough lithium for your body to work. And they don't know what a normal lithium level is because they've never bothered to check. This cracked me up. I've discovered this little ditty about 8 years ago. I started doing normal, lithium studies on normal people to find out what was normal. Why did I do that? Because I bought the machinery to do it and I wanted to test it. Okay? And it was fascinating to find out that there actually is a normal level of lithium in people that do not take lithium as part of their therapeutic regimen. So causality is a very, very important thing for you to know. Okay, just because you have a spot on a chest x-ray doesn't mean it's causing your cough. It doesn't necessarily mean it's causing your bones to ache. But again, if you don't look, you will not find. So we have patients that come in with elevated parathyroid hormones. Now, I run PTHs on just about everybody that comes to the front door. Why? Because an elevated PTH, oddly enough, will cause fibromyalgia. Oddly enough, it will cause chronic fatigue. Oddly enough, it will cause you to ache all over. Oddly enough, it will cause kidney stones. But nobody really checks it. Why? Because it's too obvious. Okay, so that gets back to conventional wisdom, but it also gets back to causality. So just because your vitamin D is too low doesn't mean it caused anything at all, in spite of the fact that we know that it has to be higher to maintain certain bits of health. So causality is what it's all about. So you have a herniated disc in your neck, okay, good. How far does it have to travel before it even touches the nerves exiting the spinal canal? And the answer is about 10, 11 millimeters. That's a half an inch. That's a long way. Okay, so it's got a long way to go before it starts doing any damage at all. So how would you be able to discover whether or not the MRI is meaningful? You look at the nerve itself. You measure the nerve. So nerve conduction velocity studies will tell you whether or not there is dysfunction there. You can then, with a positive radiologic finding and a positive functional finding, then you've got what might be closer to causality. What percentage of people listening right now are told they have diabetic neuropathy and have never actually had the nerves tested? You are being short-sheeted, okay? You know, back in the days when we were kids, we would short-sheet you. You'd be just dumb enough to get into bed and get short-sheeted and go ripping through your sheets, and we'd all laugh at you. At summer camp, it was a great sport until you had to pay for the sheets, okay? But it works a little something like this, okay? You have to test the nerves in order to know whether it's actually causing your neuropathy. And I do this all day long in my office, and we find that fewer than half the people that are told they have diabetic neuropathy actually do. It's something else, usually a tendonitis behind the knee. You fix that, the pain goes away. Gee, you just cured the diabetic neuropathy that didn't exist. Makes you look like a pretty good doc, I've got to tell you. All right? But the causality issue is something that is so important that you need to integrate this into your questions. Well, gee, doc, okay, how sure are you, okay, that my cholesterol is what's causing my angina? Because it probably isn't. Okay, how sure are you, okay, that I really need a steroidal inhaler? How sure are you that this is going to work? And then you'll be able to work your way through this stuff. You'll be able to parse it. You'll be able to figure it out. What's the likelihood, okay, that the food allergy testing that you just took is actually meaningful at all? Okay, there are tens of thousands of compounds in an average orange. Okay, which of those 10,000 compounds is causing you to become food sensitive? Okay, an allergy is an IgE issue. You break out into a rash. Okay, then you end up with food intolerances. Okay, they're very, very different from allergies. Yet these food allergy studies, these environmental allergy things, they're running rampant with these things in medical offices, and then starting people on lengthy regimens when in fact it may not be necessary at all. Looking at gluten, okay, how many people are actually out there that have Whipple's disease, sometimes known as gluten sensitivity? Not sensitivity, but it's where the villi in the gut start to deteriorate away, and the answer is less than 1%. Okay, what percentage are gluten sensitive? Okay, and the answer is about 20%. But is gluten bad for you? And the answer is yes. Why? Because it will put weight on you. So do you want to go on a gluten-free diet? It's not because you have Whipple's disease. It's not because you have non-tropical sprue, another name for it. It's because it might put weight on you, okay? Gluten-free diet is the #1 diet in the country right now. Why? Because it works. It makes you feel better, makes your tummy feel a bit better. But it's not because you have a gluten allergy. It's not even because you're sensitive to it. It's because you're taking too much of it. If you consumed too many nuts, I guarantee you're going to get a stomach ache. If you have too many sardines, I can guarantee you're going to get diarrhea. You did not have an allergy to either of these two things. But a sensitivity, you have to look for causality.
After hearing this, you might want to know more about the good doctor and the stages of life practice. What you need to do is get on your computer and go to suffernomore.com, suffernomore.com, And if you want to get on a nutraceutical program that has the nutraceuticals in your home on time, every time, go ahead and sign up for stagesoflifevitamins.com, stagesoflifevitamins.com, and we'll talk to the doctor again another day.